Hello everyone, I am Purnima from Geetanjali College of Pharmacy. Today we are going to learn about human papillomavirus. Content include what is HPV, introduction, types of human papillomavirus, etiology, pathophysiology, symptoms, treatment, diagnosis, prevention and complications. What is human papillomavirus? Human papillomavirus is a common virus that can affect different parts of your body. There are over 100 types of HPV, including strains of HPV that cause warts on your hands, feet, and face. About 30 HPV strains can affect your genitals, including your vulva, vagina, cervix, penis, and scrotum, as well as your rectum and anus. This includes the type of HPV that causes genital warts. Introduction. HPV is the most common sexually transmitted infection. It is a disease that infects the genital areas of males and females. More than 40 types of HPV are present in our population. Most people who are infected with HPV do not even know they have it. Not only does HPV infect the genital regions of the human body, but it can also infect the mouth and throat. This disease can be passed through genital contact, most commonly during vaginal and anal sex. Another method through which HPV can be passed through oral sex and genital to genital contact. There are over 100 different types of human papillomavirus, but only a few of those cause genital warts. Other types of HPV can cause cervical cancer. Now, types of HPV. There are more than 200 types of HPV. All types of HPV can live only in certain cells called squamous epithelial cells. These are normal cells found on the surface of the skin, cutaneous, and on moist surfaces and membranes called mucosal membranes or mucosal surfaces. The different types of HPV are identified by numbers and are grouped based on whether they infect cutaneous skin cells or mucosal genital cells. In human papillomavirus, there are high risk types and low risk types. High risk types including types HPV 16 and HPV 18. Low grade abnormalities of mucosal cells, high grade abnormalities, precancers in mucosal cells, various cancers. In low risk types, including types of HPV 6 and HPV 11, respiratory and laryngeal papillomas, low grade abnormalities of mucosal cells, genital warts, this rarely become cancer. Etiology. Approximately 90% of intraepithelial neoplasia is attributed to human papillomavirus infection. Only certain types of HPV cause high grade intraepithelial lesions and cancer, commonly HPV 16 and HPV 18. In most women, the infection will clear in 9 to 15 months. Persistent HPV infection is associated with cancer risk. Pathophysiology of HPV infection. Firstly, exposed to the HPV, initial subclinical HPV infection, viral replication within the basal keratinocyte layer, metaplastic cells. Within squamo-columnar junction for 3 months, viral DNA replication in episomes, production of exophytic, expression of E6 and E7. Initial HPV infection includes unresolved and untreated infection, cause CIN grade 1, CIN grade 2 and 3. These two causes in case of cancer. At last, it formed cleared HPV infection. Symptoms of HPV infection: genital warts, cervical cancer, precancerous lesions, lesions of the upper respiratory tract, and plantar warts. Most HPV infections do not show any manifestations. Such dormant infections can get activated at any point when there is a drop in Immunity. Treatment include cryosurgery, freezing warts or destroying abnormal cells with liquid nitrogen, loop electrosurgical excision procedure, using a special wire loop to remove warts or abnormal cells on your cervix, electrocautery, burning warts off with an electrical current, laser therapy, using an intense light to destroy warts or any abnormal cells. Diagnosis of HPV. Abnormal pap smear, HPV DNA lab test. Doctor sees the warts, examining infected tissue under a microscope. Preventions of human papillomavirus are HPV test, HPV vaccination, HPV education programs to the patient. Complications. The most serious complication of HPV is cancer. Cervical cancer is the most common type of HPV related cancer. Other types of cancer are such rarer. They include anal cancer, penile cancer, throat cancer, vaginal cancer, vulvar cancer. I refer this topic from websites of Medline Plus, Cleveland Clinic, and Mayo Clinic. Thank you.